My name is Randi Hagerman, and I am a developmental and behavioral pediatrician at the Mind Institute. And here's a picture of the Mind Institute. I'm not sure if you can see my cursor, but the Mind Institute is a great place with an entrance that gives hope to families with a vaulted ceiling. Hope that we will find treatment and cures for neurodevelopmental disorders. And my focus today is on Fragile X spectrum disorders and new targeted treatments. I want to thank Chris McQuade and Dr. Julian Barwell for making this presentation possible. And here's a picture of many of our team members at a luncheon. And I want to thank many of our team members. Here is an X that is in Mexico that demonstrates, I think, is a manifestation of Fragile X syndrome. And we've done a lot of work in Mexico to help identify Fragile X there and in many other countries of the world. So I am talking about Fragile X syndrome and pre-mutation disorders, and this is just a slide to make you aware that there is a big difference between the full mutation, greater than 200 repeats, where the gene is methylated, typically shut down. So there's a lack of message and a lack of protein, which causes Fragile X syndrome. And it's about 1 in 4,000 to 5,000 individuals in the general population. And in those with intellectual disability, it's 2 to 3% in most countries. And the pre-mutation is different. It's 55 to 200 repeats. There's typically no methylation, although there are some exceptions to that. But the most important difference is that it is producing too much messenger RNA. So the gene is overactive compared to those with Fragile X syndrome. And this excess message causes Fragile X associated pre-mutation conditions, also known as FAX-PAC. And it includes FAX-POI, which is primary ovarian insufficiency, FAX-TAS, the Fragile X associated tremor ataxia syndrome, and FAX-AN, Fragile X associated neuropsychiatric disorders, including problems like insomnia, anxiety, depression, chronic fatigue, chronic pain, and sometimes autoimmune problems, especially in women. Most of the time, the level of protein or FMRP produced is normal, although if you're above 120 CGG repeats, the level of protein can go down slightly. As you see in this picture, here you see the CGG repeats. And in the upper end of the pre-mutation, sometimes there's a lowering of the FMRP levels, which can lead to some features of Fragile X syndrome. But most of the time, Fragile X syndrome occurs when you're above 200 repeats. And this just shows the relative level of messenger RNA, and this can be increased. I hope you see my marker here, but it can increase up to 6 to 8 times normal, particularly at the upper end of the pre-mutation. But when methylation sets in, the level of message and the level of protein goes down to almost nothing. So it's important to remember these two differences, but in a family tree, you can see both pre-mutation problems and full mutation or Fragile X syndrome. So here's the proband, a boy who has Fragile X syndrome. His sister was tested, and she also has a full mutation, but only mildly intellectually impaired and without autism. And the mom here has FAX-POI, which is early menopause, anxiety, neuropathy, muscle pain, and she was eventually diagnosed with lupus, and we can see that in about 3 to 5% of pre-mutation carriers. And her mother here has FAX-TAS with tremor and ataxia, but she has normal cognition, although she had early menopause before age 40. And the great-grandfather of the probands down here has fax tasks with cognitive decline and dementia and neuropathy, or numbness and tingling in his lower extremities. So here's all the problems that can occur in premutation disorders. Sometimes there can be neurodevelopmental problems or social anxiety, ASD in about 10% of boys, fewer ASD problems in girls, but ADHD is pretty common even in the girls. Usually there are not cognitive deficits, but occasionally there can be. Psychiatric problems that we discussed, FAXPOI. There can be problems with immune dysregulation, including hypothyroidism. Some people also can have autoimmune problems like multiple sclerosis besides lupus, but this is rare, less than 5%. And there can be neurological problems like migraine headaches, neuropathy, memory problems, foggy thinking, high blood pressure, erectile dysfunction in the males, and then eventually fax tasks, which is tremor and ataxia, Parkinsonian symptoms, memory problems, and cognitive decline. Now, there's a lot of molecular changes that occur in the premutation carriers, including calcium dysregulation, mitochondrial dysfunction, what we call RAN translation. Sometimes a toxic protein FMR poly-G can be produced. There can be sequestration of several proteins. There can be inclusion formation and white matter disease seen on the MRI, which is part of the diagnostic criteria for fax tests. It's important to remember that there can be environmental exacerbations like alcoholism, opioid addiction, chemotherapy, exposure to toxins, smoking, stroke, traumatic encephalopathy that can be chronic, like if you're a soccer player or a football player. And also there's iron deposition in the brain, so we don't like patients taking iron if it can possibly be avoided. So as you can see, there's a myriad of problems that can occur in the premutation range, but this talk is focused on those with the full mutation. And here are 3 brothers in a family with the full mutation. And I like this picture because it shows the stereotypic movements, the poor eye contact, the hand biting or fingernail biting that's common in those with the full mutation. We also can see periodic outburst behavior, and we think this comes from sensory modulation problems, which are related to the lack of habituation because the GABA or inhibitory system is deficient in Fragile X syndrome. So what does that mean? It means when there's repetitive stimuli, as you see in these drawings down here, the vertical lines represent repetitive stimuli, whether it's tactile, olfactory, or sounds. And this is the sweat response, which is an autonomic sympathetic response. And in normals, there's the biggest response after the first stimulus, but with repetitive stimuli, it calms down, and that's called habituation. But in Fragile X, there's no habituation because the GABA system or the inhibitory system doesn't work well. So they get overexcited with repetitive sensory stimuli, and sometimes this can lead to outbursts, as this gentleman is showing here. Now, there are other behavior problems in Fragile X. Here are 2 twin brothers. They're fraternal twins. This one with the glasses has Fragile X syndrome. This one does not. So anxiety, hyperarousal with sensory stimuli, ADHD. ASD occurs in 60% of boys with the full mutation, but only about 20% in the girls. Aggression can be a problem, particularly with overstimulation from sensory stimuli. There can be what we call episodic dyscontrol. This is an outburst behavior, poor eye contact, hand flapping, hand biting, etc. Now, therapy for Fragile X is similar to therapy for autism spectrum disorder. It's multimodality therapy. So we're talking about behavior interventions. Early Start Denver model is a type of ABA, speech and language therapy, OT therapy. Some people really gain from music therapy. Exercise is essential. Some kids, particularly those that are hypotonic, really benefit from physical therapy and occupational therapy, very helpful. But we're going to focus on pharmacological interventions because you're interested in new targeted treatments for Fragile X. Now, the present treatment, of course, includes all those behavioral interventions. We also recommend a diet high in antioxidants like blueberries, green tea, omega-3, sulforaphane, that's in broccoli, cauliflower, and Brussels sprouts, pomegranate or acai berry juice, N-acetylcysteine or NAC. And then the standard medications are stimulants to help with the ADHD symptoms seen in the majority of boys and in about 60% of girls with the full mutation. For anxiety, we usually use an SSRI, something that blocks reuptake of serotonin and allows more serotonin in the synapse. And then I'm also going to talk about targeted treatments like metformin, CBD, and others. Now, I'm not going to talk so much about the neurobiology, but it's important for you to know that FMRP has many functions, and its absence in Fragile X syndrome causes dysregulation of several systems known to be associated with autism, like FMRP transport messages to the synapse. It controls and usually suppresses translation of many of the messenger RNAs important for synaptic plasticity. We're talking about hundreds, and it's thought that at least a third or more of many of the genes that are mutated in other forms of autism, that their messages are translated by FMRP. So the absence of FMRP causes three main things that I'm going to talk about. Too much glutamate, so upregulation of the mGlu-R5 pathway. Too little of the GABA or the inhibitory system, so downregulation of GABA A receptors and GABA B receptors, and lowered cyclic AMP levels. So cyclic AMP is an energy compound that helps neurons connect, and we have a new medication that can upregulate cyclic AMP levels. Dysregulation of dopamine pathways also occurs, and that can be circumvented by the use of stimulants. And of course, oxidative stress occurs in Fragile X syndrome, so the antioxidants we think are very important. Now, this is a complex slide, but I want you to see this mGlu-R5 pathway actually leads to the mTOR pathway that has two branches here. And this mGlu-R5 and mTOR pathway is upregulated in Fragile X syndrome, but the mGlu-R5 antagonists made by Novartis and other companies were not helpful in Fragile X syndrome. Acamprosate is one exception to that, and that Craig Erickson has shown that that can be somewhat helpful. But the mGlu-R5 antagonists have not been shown to be helpful, even in the Fragile X Learn study in kids that are 3 to 6 years of age. Our baclofen was helpful to a certain extent in children with Fragile X syndrome, and that will be restudied in the future. This medication has been bought by the Allos pharma company, and they plan to do more Fragile X studies. Minocycline can lower MMP9, and that was helpful in Fragile X in one study. And allopregnanolone is another GABA agonist, and we think that this could be very helpful in those with FAXTAS. And if there's time, I can talk about that because we'll do a controlled trial next year. I want to take a minute to talk about sertraline, which is an SSRI. It blocks serotonin reuptake at the synapse. And we did a couple of studies. One was a retrospective study of young children between 12 and 50 months of age. And those treated with sertraline compared to those not treated with sertraline, as you can see on the right, are those not treated with sertraline. And on the left of each graph is those treated with sertraline. They had improvements in both expressive and receptive language in the trajectory of language development, and this was significant improvement. So this led to a controlled trial of low-dose sertraline, just 2.5 to 5 milligrams per day, so very low doses in individuals between the ages of 2 and 6. And what we saw is this is how many months more or improved they were on sertraline versus placebo. And the cognitive T-score was significant, visual reception was significant, fine motor significant. There were raw scores that also were significant. The receptive and expressive language was a bit better, but it wasn't a significant change until we looked at those that had autism together with Fragile X, and that was 60% of this population of young children, and they had significant improvements in expressive language on sertraline versus placebo. So that was a significant change, and it suggests that those with Fragile X and autism, and of boys, that's about 60%, were improved with low-dose sertraline. And mainly, the obvious thing we see is they start talking faster. Now, CBD, or cannabidiol, is the non-psychotropic part of marijuana, and people have been using it off the internet for several years, but Zynerba makes a manufactured CBD preparation that has no THC in it. It's called Zyn-002, and it's an ointment that you rub on the shoulders or on the thighs twice a day. And they did a controlled trial of this, and CBD has a lot of different effects. It actually blocks pro-inflammatory cytokines, so it is anti-inflammatory. It helps mitochondrial dysfunction. It counteracts the effects of THC, and it boosts serotonin, so it has many positive effects. And they did a CONNECT study, which was a controlled trial of 12 weeks of the ointment in children with Fragile X syndrome. And this has been published, and they found that there was a significant difference between placebo and Zynerba, and then they went on an open label study at the end of this controlled trial. And what they found was significant improvements in social avoidance. But this was only for the group that had greater than 90% methylation that reached statistical significance. And there were secondary parameters that were close to significant, and also the parent questionnaires showed some significant benefits. But the FDA wanted them to do another study where they really focused on, and their main hypotheses were on those with full methylation or greater than 90% methylation. So a very similar trial called the RECONNECT study is now going on at multiple centers, and if this shows efficacy, it will become FDA approved and will go on the market. So we found that CBD topical can be very helpful for many aspects of behavior, including aggression, outburst behavior, anxiety, and it improved quality of life for many families. They were able to take their children to restaurants and, you know, a lot less or fewer behavior problems. Now, I want to switch to metformin. And metformin has been around a long time because it's found in a French lilac plant. So it was even used in ancient Egyptian times. And there was some writing on a papyrus talking about the use of this plant for many, many problems. Its main use today is for treatment of type 2 diabetes, but it also helps you lose weight. It's known to help with overeating and obesity. It can prevent cognitive deficits in those who are diabetic. It actually is protective against cancer because it downregulates the mTOR pathway, which produces many growth-promoting proteins that are lowered with the use of metformin. So it was helpful in several patients with the Prader-Willi phenotype of Fragile X. That means obesity and hyperphagia, and many of these individuals can have severe obesity, but that is present in less than 10% of those with Fragile X syndrome. But we also found out in this initial study that it was helpful even for young patients that didn't have obesity. Now, the animal models, including the Drosophila and the knockout mouse model, found that Metformin rescued many of the phenotypes in the knockout mouse, and it improved the circadian rhythm and memory problems in the Drosophila. So it was pretty helpful, and it's a medication that does not have significant side effects. Sometimes it can cause loose stools if you up the dose too quickly. So we like to up the dose very slowly. Now, normally there can be IQ decline in both young patients and in adolescents. But here are two case reports where metformin improved verbal IQ and nonverbal IQ. And here's a 12-year-old boy that had pretty severe obesity, and he was treated with 2 years of metformin. This was before puberty, and his weight really normalized. And when I saw him again at age 14 and he was Tanner stage 3, he had normal sized testicles. So it may be that some of the excess proteins produced from that mTOR pathway is what leads to macroorchidism, and maybe that can be reversed if metformin is started before puberty. We've also seen it helpful in 2 to 7-year-old kids at a lower dose, of course, starting with maybe 50 or 100 milligrams once or twice a day, and then the dose gradually increased. Usually a 6-year-old can tolerate 500 milligrams twice a day without difficulty. But in younger kids, it really helped with cognitive enhancement compared to what's been published in the medical literature. So we tend to use it also in younger patients, and we think that that can improve development. Now, we have done a control trial of metformin with Fragile X syndrome, those ages 6 to 45. This was funded by the Azraeli Foundation. It's a double-blind crossover study, a double-blind control trial with metformin versus placebo. And we did it at the Mind Institute and 2 sites in Canada. And then they were put on open label metformin, which was a clinical follow-up. And we had a lot of measures. We haven't published these results yet because the 2 Canadian sites are somewhat slow in their recruitment. Hopefully they'll finish their recruitment by the end of this year. And so in the springtime, we hope to have a report about the controlled trial of metformin in Fragile X. After the controlled trial, they were put on open label metformin, and we had several patients, 26, who we were able to follow the lighter 3 IQ, which is a nonverbal IQ, and the Vineland. And this just shows improvements, at least in the raw scores, on the lighter. But the overall IQ, just for the overall group, went up from 57 to 58. So not much improvement. That wasn't statistically significant. And on the Vineland, as you can see from the baseline and the follow-up, there were improvements on the Vineland. Some people had fairly dramatic improvements, and we saw that with IQ too. But the important point here is that we did not see IQ decline, which is typical for many individuals with Fragile X syndrome. I want to talk about the Tetra study because they did a phase 2 of the Tetra drug, which is called BPN 14770 or Zitolamist, which demonstrated in 30 males with Fragile X syndrome who were adults that many aspects of the NIH toolbox got better. Now, this Tetra drug improves cyclic AMP because it inhibits the enzyme that breaks down cyclic AMP. So phosphodiesterase 4D or PDE4D, it's an allosteric inhibitor. So it stimulates the level of cyclic AMP, which is too low in Fragile X syndrome. And what was found in these adults were that reading recognition significantly improved, picture vocabulary significantly improved, cognitive crystallized intelligence significantly improved, and the caregiver ratings on the visual, the VAS which is a visual scale, showed benefit in language and daily functioning, a visual analog scale. And now there is a multi-center study going on in internationally. We're part of it. We're enrolling adolescents and adults with Fragile X syndrome. And hopefully the results of this will be published next year. And hopefully pediatric populations will start, probably not in 2023, but maybe in 2024, we'll be able to do it on children. So now we're only able to do it on individuals that are 13 and older. So zatolamilast, which is BPN 14770, this is its structure. And this just shows how much better they were in the toolbox ratings on zatolamilast compared to placebo. On the visual analog scale, they mainly had improvement in language. Anxiety was somewhat improved, but it wasn't statistically significant, and daily functioning was significantly improved. So this is very exciting because this is the first drug that definitely shows significant cognitive improvement over time. And people are very excited about this because even adults could improve cognition. Now, to just give you a taste of the future, psilocybin is a tryptamine derivative found in magic mushrooms. It's a serotonergic agonist and activates serotonin receptors. And Nova Mentis is doing a trial of this magic mushroom preparation in Australia. So far, it has not, we don't have any results yet, but it's supposed to help with anxiety and behavioral rigidity. Just before I finish up, I want to say that gene therapy will become an intervention in the not too near future, or in the near future, I should say. And there was one exciting paper that came out from Richter's laboratory showing that up to 70% of patients with Fragile X produced a misspliced isoform called FMR1-217. And this isoform is, they feel it's responsible for the lack of FMRP production because it's involved with methylation of the gene. And when they used an antisense oligonucleotide directed to this message, the FMR1-217, it reversed the methylation and led to significant production of FMRP and opened up, demethylated it. And so here you can see an antisense oligonucleotide. And then for those that were not producing messenger RNA, the other 30% with a full mutation, they treated it with a demethylizing compound called 5-azacitidine, and it demethylated the gene, and then they used the ASO to get rid of this FMR1-217. So this is an isoform, and it's an example of an intron retention that is counteracted by the ASO. So this is a new paradigm for thinking about what causes the methylation. So there's some of the intron along with exon 1. So this is the misspliced message that's thought to lead to methylation in a full mutation. So they treated that with ASO and cell culture, but ASO therapy is also being used in several genetic conditions like SMA and myotonic dystrophy, Angelman syndrome, even ALS. So it's a gene therapy that's easier to do than replacing the whole gene. And so this may be the first way that gene therapy is going to be utilized in Fragile X syndrome. I just want to comment that there are treatments for pre-mutation carriers, SSRIs, exercise, alleviating any factors that lead to CNS deterioration, avoiding toxins, including isoflurane and general anesthesia, giving yourself lots of cognitive stimulation. And next year, we hope to have a controlled trial of oral allopregnanolone which is a natural neurosteroid that can improve mitochondrial function. And PureTech is a company that has produced an oral version of allopregnanolone. So we hope to be studying that next year in those with FACS-TAS, and these studies were funded by the DoD, but we just need the FDA to approve its use. I want to thank all of my collaborators and our team working on the clinical trials program. And I want to thank you all very much in England for listening to me. And I hope to take questions when I meet with you live in just a few days. Thank you very much.